Hello there and welcome back to my channel. I trust you have been keeping in good health. Thank you. I'm happy to know you're okay. So today I will be talking to us on practical tips on how to read, understand and follow drug labels and warnings. Actually, this topic became important to discuss when I got feedback from my previous videos asking me to talk more on this topic, when I discussed about over-the-counter drugs, and I informed us that one of the very important ways to avoid common mistakes people make when using over-the-counter drugs and then incur the risk associated with this common mistake was to properly read and understand the labels. One of my viewers reached out to ask me, how do we read and understand this label? And that is why I am making this video today. Please note that the drug I'll be using today to talk to us, to teach us how to read the labels, is strictly for example. I am in no way advertising this drug. So let's get right into it. Say we go into a pharmacy to get paracetamol, right, for headache or fever in a child. Okay, for today we'll just be limiting ourselves to syrup, which are liquid preparations used mainly in children. You go to the pharmacy and you pick up a drug. First of all, note the name of the drug. This is paracetamol syrup. Note that all drugs have, two names: the generic name and the brand or the trade name. The generic name is basically the active ingredient in the drug. For paracetamol, that's the generic name. It's paracetamol or acetaminophen. Then the brand names can be anything, maybe Nijamol, Arakmol, or anything like that. But the generic name is paracetamol syrup. So you go into a pharmacy and you pick up a drug, the paracetamol. You make sure that it contains the active ingredient, paracetamol. And what is the strength of the paracetamol? Here it's 120 milligram per 5 mils. That is to say, if you measure out 5 mils of paracetamol, if you measure out 5 mils of this syrup, it will contain 120 milligram of paracetamol. Now, depending on some factors like the age of a child, the weight, the body surface, even the sex, of a patient. These are factors that determine the dosage of the drug. So please make sure to follow the recommended dosage of a drug. It's usually written for over-the-counter drugs. It's usually written on the body of the drug, or if it's not here, you may check the leaflet inside the drug. It may be boldly written on it. Now, for this paracetamol, the dosage is based on weight, right? I don't know if you can see it. It's based on weight. And it says here, for ages under 1 year, 2.5 to 5 mils, which is half to 1 teaspoonful, to be taken 3 times or 4 times in 24 hours. Let me take that again. Under 1 year, 2.5 to 5 mils, and in bracket is written half to 1 teaspoonful, to be taken 3 or 4 times in 24 hours. Please, before I go further, I want to touch on something. When we say teaspoonful, we do not mean the spoon you use in the kitchen. Most times, those are not accurately calibrated. Most drugs come with their dispenser, the small cap on the drug. These have been accurately calibrated to give you the correct measurement of the dose of the drug. So do not just run to the kitchen, pick a spoon and say this is small spoon, so it's a teaspoon, this is big spoon. No. Most times we have realized that it doesn't measure up, or it measures more than the required dosage. Now, you may wonder why we don't have a particular dose. Why is it 2.5 mils to 5 mil? Like I said earlier, the dosage of a drug depends on several factors, one of which is age, body weight, and then again the severity of a condition can determine whether to use the minimum available dose, which is the 2.5, or the maximum, which is the 5 mils. And then here it says take 3 or 4 times in 24 hours. When we say 3 times, we don't mean any time of the day. You just take one in the morning, one in the afternoon, one in the night. No, that's not the proper way to take a drug. we will be talking more on how to accurately measure your drug, take the correct dose depending on time. Okay, so when we say 3 times, please make sure to time your drug so that it is exactly 8 hourly. So if you take by say 7 a.m. in the morning, you know that you are repeating it by say 3 p.m. in the afternoon, and then at exactly 8 hours later by 11 p.m. you are repeating it. If you want to take it 4 hourly, you make sure to divide the time into 4 equal parts. That is to say, if you take by maybe 6 a.m., you're repeating at 10 a.m., you're repeating at 2 p.m., and then you're repeating at 6 p.m. again. So 3 times a day, 4 times a day should not be random. Please ensure that they are timely so that at every point in time, the dosage of the drug in your blood remains constant. Now moving on, it says here that do not exceed 4 times in 24 hours. This is a very strict instruction. Remember that we said that some drugs cause damages to our organs if they are not properly used. Paracetamol has been known to be hepatotoxic, that is, it damages the liver if it's in excess. Okay, so when it says here do not use for more than 4 times in a day, it's simply trying to save you from side effects, and also to make you understand that if you have been taking this drug 3 times, 4 times, and the fever still persists, it means the condition should be critically looked at. It may not be something that only the paracetamol can solve. So please do take, very importantly, every instruction you see on a drug label. It is for a reason. Now, this is a very important instruction. It says, if symptom persists after 2 days of taking this paracetamol syrup, consult your doctor. In my last video, I told us that one of the dangers of taking OTC drugs is that it may mask the very important ailment that you should be treating, because these OTC drugs may just take care of the symptoms, and then the disease that is causing the symptoms may be overlooked. So once you are taking this drug and maybe after 2-3 days there is no relief, it's time to seek medical attention. OTCs are not meant to cure diseases, okay, that may be underlying in our bodies. So when you take them for a while and maybe 2-3 days and there's no improvement, please seek medical attention. So yes, for today, that will be all we're going to deal with. Look at the indication. It says effective on pains, aches, and feverish conditions. Very important. It's telling you the indication, what this drug can be used for. Do not assume that this drug can do the job of an anti-malaria or it can do the job of an antibiotic. It has been clearly stated here what the indication of this drug is. Now, when you take into mind or when you take to heart the instructions of a drug and use it as the manufacturer has told you to, you will get the best out of the drug. And always remember, you can always consult your pharmacist on drugs because they are drugs or medicines experts. Continue to stay in good health, and I'll see you in my next video. Thank you.